Hello everyone, my name is Ruhaib Sayed, and today I'll be discussing one of the most infamous cases of unethical research in history, the Tuskagee syphilis study. This experiment, conducted by the U.S. Public Health Service from 1932 to 1972, involved in hundreds of African Americans who were deceived and denied treatment for syphilis. This case is a stark reminder of the critical need for ethical standards in medical research and the devastating consequences that arise when those standards are ignored. The Tuskagee syphilis study began in an era of racial segregation and systemic medical discrimination. The researchers aimed to observe the progression of untreated syphilis but chose to withhold treatment from the participants even after penicillin was discovered as an effective cure in the 1940s. These men were misled into believing they were receiving free healthcare while being used as subjects for unethical experimentation. The study continued on for 40 years despite growing awareness of its unethical nature. Public outrage only surfaced in 1972 when a whistleblower exposed the study, leading to its termination. In response to this egregious violation, the United States government issued a formal apology in 1997, acknowledging the harm done due to its victims and their family. Several ethical violations were committed in this study. One was lack of informed consent. Participants were not fully aware about the true nature of the study and were misled about receiving treatment. Another was deception and exploitation. The researchers took advantage of a vulnerable population by withholding life-saving medication under the guise of free medical care. Another one was violation of autonomy. The study disregarded the rights and well-being of the participants in favor of scientific observation. Many participants suffered severe health consequences. Some died, and the disease was transmitted to their families. This led to intergenerational trauma and medical distrust within the affected communities. The Tuskagee syphilis study had lasting consequences beyond the immediate harm to the participants. It created deep mistrust in the medical institutions, particularly within the African American community, leading to reluctance in seeking medical care and participation in clinical trials. The mistrust still exists today and poses challenges for public health initiatives, including vaccination campaigns and disease prevention efforts. Furthermore, laws and policies were put into place to mandate transparency and participation in clinical trials, ensuring such abuses would not be repeated. As future dental hygienists, understanding unethical research practices is crucial because we will be responsible for upholding ethical standards in patient care. Ethical principles such as informed consent, patient autonomy, and beneficence must guide our interactions with patients. Furthermore, many patients may still hold fears or skepticism towards medical and dental professionals due to the historical unethical practices. Acknowledging these concerns, practicing with transparency, empathy, and cultural sensitivity can help rebuild trust. Awareness of these past ethical failures reinforces our duty to advocate for ethical research and practice, ensuring that the patient trust is maintained and that healthcare remains patient-centered and just. In summary, the Tuskagee syphilis study stands as a powerful lesson on the dangers of unethical research. By studying these past failures, we can appreciate the importance of ethical guidelines that protect participants today. As inspiring healthcare professionals, we must commit to upholding these ethical standards in our practice to promote trust, integrity, and the well-being of all patients. Thank you for listening, and I look forward to hearing your thoughts and discussions on this crucial topic.